Hello and welcome to today's Society program with me, Florence Lowenbo. I'm here with Dr. Rufina Latu, who is a WHO country office in PNG, and Professor Alec Ekerome, who is from New Zealand, a PSRH Secretariat. So could you tell me about what are the purpose of the conferences, the PSRH conferences?
Okay, thank you very much, Florence. The purpose of the Pacific Society of Reproductive Health workshops and conference is to bring together our health workers in reproductive health from across the Pacific Islands to learn skills and learn knowledge about, update their knowledge about reproductive health, and also to network and share stories and ideas about how to improve their services when they return back home. And so it's a 6-day workshops and conference, and the workshops ran for 3 days, and there were 6 workshops and different areas, of course, addressing different skill sets. And then we have a conference on for 3 days, and it provides a platform really for our clinicians and our researchers from across the Pacific to, again, disseminate their research evidence from where they work, and also to inform other health workers of that research evidence, and with the hope really that then it builds capacity of our workforce, but at the same time also it improves care that is delivered to our communities. So that's the purpose.
What about the theme for this year, reproductive health and the sustainable development goal, a catalyst for accelerating progress? Could you tell why the theme this year is this theme?
Okay, we have an organizing committee to think through the program, and we thought it was timely to highlight the importance of the Sustainable Development Goals, which came into effect in January 2006. So we have framed the conference theme around that, and it is Reproductive Health and Sustainable Development Goals, Catalysts for Accelerating Progress. We realize that a lot of our health workers live in remote environments, communities, rural hospitals, and we need to come back together to revisit what is important as catalysts to drive the change, to make some improvements for mothers and newborn babies.
So with this conference, what are the changes or development that has occurred from these conferences?
There's been a lot of improvements over the past 24 years of our existence. When this particular society was formed, in its early stages, there were only a few of us that could or would attend. But now the society has actually grown from strength to strength, and now it's a recognized professional body in the Pacific, where other organizations will come and talk to us about how and to assist and collaborate with them in developing our workforce. So there's been a lot of changes, and I feel that professional organizations like ourselves, when we network and make things happen, then that improves capacity building health services to our communities. And there's been a lot of developments, really. I mean, it'd be nice to have easy measures of outcomes that shows that our lives have been saved and the services have improved as a result of our interventions and our conferences. But again, most of these things are very hard to measure. But I know that from talking to our health providers, our members, that they are motivated, they feel encouraged to actually carry on the work back in their places, and that their knowledge have actually improved as a result of attending these conferences.
So what are the topics that we talked about in the first day of the conference?
Revolving around the theme, We talked about various things, various issues related to maternal and newborn health. Before the conference proper, which is really 3 days, we had a series of workshops, 6 technical workshops running in parallel, so that the more than 300 nurses and doctors and midwives who are here this week could engage in some skills building workshops. And we ran that for 2.5 days, from Thursday, Friday, and half of Saturday. And various things like family planning, emergency maternity care, research, and x-rays and scannings, and how to do mini operations and those kinds of things. And then, starting on Saturday evening, we officially opened the workshop with the Honorable Minister of Health and his delegation from government. And then on Sunday, we have a short church ceremony to make people feel good that they were going to church. And then we had the Honorable Prime Minister opening, officially providing a keynote address for the conference. And he talked about Sustainable Development Goal, reproductive health, and gave a glimpse of how his investment, the government of Vanuatu's investment in maternal and newborn, has made some strides into the improvement of mothers and newborn baby. And this actually set the scene for discussion. So over the last couple of days, we have been talking about Sustainable Development Goals. We've talked about family planning, gender-based violence as an issue, very serious issue in Pacific Island countries. And we're talking about how can we reposition ourselves to become catalysts for change, to bringing about progress in these areas of mothers and newborns and children and families.
Thank you once again for joining the program.
Thank you very much for engaging us.